Today, our first guest is Michelle Sumrall. She's the manager of Respiratory Services, Cardiac Rehabilitation Services, and Cardiovascular Diagnostics at Novant Health Brunswick Medical Center. Welcome to the show today, Michelle. I'm so happy you're here.
Thank you, June.
You have a lot of exciting news for us today.
We do. We have a lot of exciting things going on in the market.
But first, you have so many talents and you're involved in so many things. So give me your backstory on your 15 years at Novant Health.
So I'm very fortunate to be able to have been here as long as I have been and be able to treat so many community members. As you said, I am with Respiratory, Cardiovascular, and Cardiac Rehab, and they all intertwine at some point in time, which is wonderful to kind of see full circle, you know, all the things that our patients go through in their journey when they're here with us. And so all those things have helped me throughout the years take care of our community.
Mm-hmm. Did you start at that level or did you start as a respiratory therapist?
I actually did start as a respiratory therapist here, PRN, when my kids were younger.
Wow.
Just worked when I could, and it worked for our schedule, and I was very fortunate to have a manager who wanted me to come on full time. I came on full time, and then I was her succession planning, and here we are.
And here we are today. So let's talk a little bit more in depth about all the services that you do manage. So let's start with respiratory services.
Mm-hmm. So we have an extensive team here for respiratory with lots of years of experience, some that surpass me, which I'm very fortunate to have those members on our team here to take care of our patients. We do everything from breathing treatments to running mechanical ventilation. As much of our audience will be aware, COVID, kind of brought us to the forefront as healthcare professionals, and this team did phenomenal work taking care of this community. So we're just very blessed here.
We are, absolutely. Well, okay, let's move on to cardiac rehab and diagnostics, and I know that you love this. What exactly does that involve, and how does that all work?
So both sides, cardiovascular, we see patients, we come in and, they're really coming in here to take pictures of their hearts, right? Hearts and how their heart's working, how all the pumps are working, making sure everything's working efficiently. And then on the cardiac rehab side, if those hearts aren't working efficiently, I may see them over there as well, and they get a referral to us for us to come and help, rehab them so that we can get their hearts working like they should. We work very close with the cardiologist in devising a treatment plan that works best for that patient and what they need in their plan of care. Our exercise physiologists, our nurses, our dietitians, we all holistically work together to take the best care of them and their heart and to get it back where it needs to be.
Okay. So a typical patient may have just had surgery, right? And that would be part of their recovery?
Exactly. So, a typical patient could go and have something like a stent placed in their heart or bypass surgery. After they are cleared by their provider, they will come to us, and in a 36-week sessions, we will take care of them and exercise, because exercise is one of the best medicines for any of us, and especially after you've had some type of surgery, especially dealing with the heart. And they will come to us, and we will teach them things, how to eat. We even do yoga with our patients, relaxation. Stress, we know, is a leading cause of heart-related issues, and we teach them, de-escalation techniques and all those things.
Oh, wow. How about, are there many cardiac patients who need the rehab but have not had surgery? Is there a program for them?
There is. So we have congestive heart failure patients.
Okay.
Once we do an echocardiogram, that would be in my cardiovascular diagnostic service line. If their ejection fraction is low enough, they may not have ever had surgery. They will come to our cardiac rehab. We will work with them to try and get that, what we call ejection fraction up. And those patients, we keep them from, potentially having to have those surgeries. And that's the best part, is doing less invasive things to be able to take care of these patients so that they don't have to have those surgeries.
Well, tell me a little bit more about that 3-month specialized cardiac rehab program that we offer. You touched on dietary and many things. So who provides that? It's not the respiratory therapist, but you bring in other specialists, correct?
Absolutely. So like I said, we take a holistic approach to the patient. So we bring in dietitians, we have exercise physiologists, cardiac nurses. I will have yoga instructors also on the plan of care for these patients. And together, along with the cardiologist, we will devise a plan, an exercise plan that is safe and most effective for the patient. And it just takes a holistic approach to, we have to look at their diet, we have to look at their behaviors, what are their stressors in their life that we can help them learn and identify so that we can make them feel better and get better after such a life-changing event.
Does it always last 36 weeks?
So it's not necessarily 36 weeks, there's 36 sessions.
Oh, 36
so
sessions.
Some patients can choose to come 2 days a week or 3 days a week. Most of our patients choose to come 3 days a week. And then we will, barring any absences from class or whatever, typically around 3 months we can get them in and out.
It seems like a long time, but it really isn't.
It's not.
Those go by pretty quickly, the 36 sessions.
Yeah, and our main goal is to teach them things so that they can continue that when they go home. Because an exercise regime should be part of their daily routine or, their lives so that they stay well.
Yeah, so it's a lifestyle change.
It's a lifestyle change.
Yeah. Well, there's a lot of excitement around here, so let's talk about that. Well, tell me about the new cardiac rehab space.
Yeah, so we're very fortunate. Like I said, there's a lot of interesting and fun changes coming to the market. We are going from a 900 square foot gym to a 4,000 square foot gym. Currently, right now, we can have 10 patients in a class. We're going to where we can have 16 patients in a class.
Wow, that's a huge.
We're getting so many referrals that we're booking out to May right now. And so this added space will allow our patients to have a bigger gym. There's a walking trail. We have what
There's
we call
a walking trail?
a walking track, I should say,
in the-
around our gym. We are going to have a Zoom room where we will do Mediterranean diet classes with our counterparts in Charlotte and Forsyth, so that.
And the Mediterranean diet seems to be a very heart-healthy diet.
Very
correct?
heart-healthy, and teaching patients. We touched on that behavioral piece.
Yeah.
But teaching patients how to change their diet, but still be fulfilled with what they're eating, right?
Which you like, but.
Yeah, and so getting them to understand the Mediterranean diet and being able to wrap their heads around it. And so that Zoom room will allow them to, and allow us to utilize resources all over the market. So we'll be able to utilize resources from New Hanover, like I said, Forsyth and Presbyterian as well.
Yeah, that sounds wonderful. I'm curious, since COVID, have you seen an increase in enrollment in the rehab program?
So unfortunately, we have seen a lot of patients, of course, with breathing issues. For our rehab program right now, we haven't seen a lot of increase. We know the need is there, but because of our size, we haven't been able to take those patients on. When we move to the new space, we will be adding pulmonary rehab. And that's where we'll start seeing those patients, I think, more and getting those referrals, because there was a lot of injury to people's lungs. And right now, the closest pulmonary rehab is in Wilmington. And that's a far drive for our patients who really don't want to cross the bridge. And so part of our growth plan, once we get over there, is to add pulmonary rehab so that we can take care of those post-COVID patients a little bit better, because they are seeing lifelong issues with their lungs that we're finding.
Yeah.
And hearts too.
In the new space, where is cardiac rehab located in the new building?
So we're fortunate we got a premium spot on the first floor with lots of windows. Our old gym had no windows, and that was one of our patient complaints. So we have lots of beautiful sunlight coming in, lots of bright colors. We're in Suite 101, which is underneath of our cardiologist. So if we ever need them, we hit a button, it will alert them to come down to us, and they will come down and take care of, help us take care of the patient and let us know where we need to send them, if they can go home, and it's safe for them to just relax and calm down, or if we do need to proceed to the emergency room. Most of our patients are Novant Health Heart and Vascular patients already. So those providers know them. They know what they need, and they are the best ones to help us in those emergency situations. If it's a really bad emergency, of course we will call 911 and they will
sure.
come. But we are very fortunate to have the cardiologist right upstairs.
And the Novant Health Heart and Vascular, they were formerly Cape Fear Heart, and so everybody knows Cape Fear Heart in our community. So that's really great that they're right upstairs.
Yes.
And that you have the ability to call them at a moment's notice.
Yep. We literally will just hit a button on the wall.
Wow.
It'll alert them, and they'll know where to come.
I cannot wait. I can't wait to see it.
Yes.
So, I heard something interesting that you're the chair of the Election and Nominations Committee for the North Carolina Society for Respiratory Care. Tell me more about that. I know it's a nonprofit, correct?
It is. So I kind of got voluntold, but I always do all the things that will help, our career and professional growth. And so that is our state society for all things respiratory care, right? And so in order for us to stay on top of all the things that are coming out and the new guidelines, that's where it starts. And we really push for, scope of service for our RTs to practice, with autonomy. And we have a lot of autonomy here. And so I like being on that committee with the state society just to know what's going on around the state, because that allows me to bring things back to our respiratory team that we can use here for our patients.
Yeah, it seems like it would be helpful in your job as a manager of all these different services you would be on top of things and know things like before most people do.
Right.
So you can bring that back to your team. Well, Michelle, this has been such a great interview with you. I've learned so much, and there's just so much to share now. So many exciting things that we can all celebrate. Before we wrap up. How can people learn more about your services and what we have to offer here at Novant Health?
So of course we have our website, novanthealth.org, and
Right.
you can find the cardiac rehab services on that site. Anybody is welcome to call me or call my team, and they are happy to answer any questions in the cardiac rehab, and that will help, let them know where they need to go, where to start.
Yeah. All right, Michelle, thank you so much for being here today. I look forward to having you back after we have some time with our new space and tell us how it's going.
Absolutely. Thank you so much.
Thank you.